Okay, welcome to Anglia Ruskin University, Faculty of Health and Social Care. I'm Vanessa Waller and I'm the Director of Pre-Registration Nursing. I'm here today to tell you about the degree programme that you're applying for and that you're being interviewed for today. You're coming into nursing at a really exciting time in the profession. As you've probably seen in the media, nursing is moving to an all-graduate profession. It's the first time this has happened and will put us on an equal footing with all the other healthcare professionals. It will really improve our image, and we're in a very privileged position as nurses to be able to coordinate, lead and organise care for people when they're very vulnerable, for patients and their families and carers. So I hope you feel as excited about nursing as a profession as we at the university do. The programme itself is a 3-year programme and is split into modules. There are 3 modules within each year. Some of the time, well, half of the time, you will spend in the university in theory, learning about how to do nursing, what's the evidence that supports nursing, and being able to practice some of the skills. We have fantastic skills laboratory facilities where you can have a go at doing things like how do you move a patient, how do you give injections, how do you do dressings, how do you plan care for someone who's very ill, how do you communicate with them and their families so they feel reassured and safe in the care that you're giving. So you will have those opportunities to practice with each other, with the clinical staff and with the tutors. And then you'll go out into practice and perform those cares and those skills in a real clinical environment. 50% of your programme will be spent in that clinical environment. Some of that time will be in the community because we look after people in their homes, in GP surgeries, in nursing homes, in daycare centres, and you need to go out to those areas to care for those people. And some of the time will be spent in hospitals. That could be on medical wards, surgical wards, in critical care areas like theatres, accident and emergency, intensive care units. Some of you will experience placements in other areas to look at alternative branches. So for example, if you're applying to come onto the adult branch, you'll have an opportunity to look after people with mental health problems, and the same with mental health, you'll have the opportunity to look after people with physical health cares in an adult setting. Those people on the adult pathway will also have to have some experience of maternity care. It's something that we need to do to meet the EU directive. So you'll be working with midwives or health visitors or nursery nurses to experience caring for pregnant ladies and their newborn babies. Because you do go out and do these placements in the real clinical settings, it does mean that you'll be working shifts. Now those shift patterns will vary from place to place, but it could mean you starting a shift at 7 in the morning and working through till 7 or 8 in the evening. It could be that you do those long days. It could be that you do shorter 8 or 9 hour days where you may start early in the morning or you may start at lunchtime and go through to the evening. You'll also do night shifts and you'll be expected to work weekends. Now you won't be expected to work every weekend, but you do need to be aware that nursing is delivered 24 hours a day, 7 days a week. Patients are ill, whether it's a normal working day or whether it's a bank holiday or a weekend, and we need to be there to care for them. You also need to be aware that you'll have to travel to those areas. Now we will try wherever possible to place you in a locality close to your home. But as you can imagine, when we're trying to place so many students in a vast area over Cambridgeshire and Essex, you do have to do some travelling. It is your responsibility to make sure you get to your placement area for the beginning of the shift, wherever that is. So you do need to be aware of that. Another thing that you need to be aware of if you're new to the caring profession is that you'll be nursing everybody. You'll be nursing women, men, young adults, children, older people, and certainly with the demographics of the UK at the moment, we're in an ageing population. So more and more you're going to be nursing older people, both men and women. You'll be assessed in practice. You'll have mentors out there. You'll work with a mentor who is a registered nurse or a registered healthcare professional, and they will work with you. They'll help you to practice the skills that you've learnt in the university, and then they will assess you doing those skills out in practice. They'll give you plenty of feedback so that you know what you're doing well, what are the skills that you need to work on to improve. And we also talk to the patients and the families to get their feedback, to see what they think of your nursing skills. And that all put together will form your assessment, and you'll be given a mark in practice that will contribute to your overall degree classification. There are assessments in theory as well. When you're in the university, you are assessed. Now, those assessments can be anything from an exam that you do, a multiple choice exam that will be done online, through to presentations, through to writing assignments, smaller assignments at the beginning that get bigger as you progress through the programme, and ultimately your dissertation, which is quite a large piece of work. But you'll be given lots of support to do that work. You'll be allocated a personal tutor at the beginning of the programme who will be someone appropriate to the branch of nursing you're applying for, and they will hopefully stay with you for the whole 3 years to support you. They'll give you tutorials, they'll give you advice about essay writing and about preparing for presentations. And throughout the 3 years, we make sure that there are study skills in there for you. So we might talk about how in the first year, how do you prepare for exams? How do you do your presentation? How do you write your essay? How do you do references? Those skills will be very new to some people, and we will work with you to build them up. As you go into your second year, we'll revisit some of those things. So how do you do writing at a higher level? And again, at the third year, how do you search for evidence at that higher level, and how do you write at that level? So we will put in study skills alongside the tutorial support to make sure that you're prepared to do your assessments. Tutorials are available regularly throughout the programme, either by the module leaders and module teams or by your personal tutors, and we strongly urge that you take up that facility. There is annual leave within the programme. We have 9 weeks annual leave within the programme, and it's planned to try and coincide as far as possible with some of the school holidays, although this won't always be the case. We aim that you'll have some time off at Christmas, some time off at Easter, and some time off in the summer holidays. We set those dates at the beginning of your 3 years, and we will give you the holidays and the plan for the entire 3 years. Those holiday dates are not negotiable except in exceptional circumstances, because we have to plan the programme and the assessments and your placements for every group of students that goes through, so we cannot be flexible with those. It's a really good programme. It's an exciting time in nursing. Our university is making really big strides ahead with the facilities we've got, both for the skills laboratories, in terms of the library facilities we've got, and our practice partners that we work with, the mentors and the nurses out there, are incredibly supportive of the students. I hope you really enjoy your time at Anglia Ruskin University, and that you register with the Nursing and Midwifery Council at the end of a 3-year programme and go on to be innovative, exciting and very caring nurses in the future. Thank you.